All right, we got the cardiovascular system. We just did blood in the last video, so this makes sense. How does the blood get moved around the body? We call it the cardiovascular system, singular, but it's actually two systems in one, as we will see. So, as usual, I'm going to talk about the function and anatomy of the heart and circulatory system, and then talk about the word parts. I have divided this up, so I'll talk about the heart's anatomy and then word parts for the heart, and then I'll talk about the blood vessels, and then talk about word parts for the blood vessels. So the heart's job is to pump the blood through the body, and there are actually two separate but connected circulatory systems, as you'll see in a minute. Together, the heart and the blood vessels are responsible for making sure there's sufficient blood pressure to get blood where it needs to go, sometimes against gravity. It's like up to the head, or if you're standing on your head, all the way up to your feet. So no matter what the body position is, the job of the heart and the blood vessels is to make sure that blood gets to where it needs to go. Here's a good picture of the heart. I'm going to start over here in the right atrium. Blood that comes back to the heart comes back in either the superior vena cava or the inferior vena cava. These are the two largest veins in the body. Obviously, blood from the head and arms comes back in the superior vena cava. Blood from the chest and lower extremities and abdomen comes back in the inferior vena cava, and they both come back to the right atrium. The right atrium, then the blood flows through the tricuspid valve, sometimes called the right AV valve, into the right ventricle. From the right ventricle, blood will flow up through the pulmonary semilunar valve, got its name because the flaps of the valve look like half moons, into the pulmonary trunk. The pulmonary trunk then splits in, heads to either the left lung or the right lung. Blood's out to the lungs to get oxygenated. Coming back from the lungs, it comes back in the pulmonary veins, and you can see two of them over here. There's some behind the heart in this picture, but both from both lungs, blood comes back to the left atrium. From the left atrium, blood would flow down through the mitral valve, sometimes called the bicuspid valve, sometimes called the AV valve. The bicuspid valve has two flaps called cuspids. Somebody thought they looked like teeth. Tricuspid valve has three flaps that they thought looked like teeth. It's very clear if you just say left AV, because that means left atrioventricular. It means between the atrium and the ventricle. That's a very clear way of saying left AV. There's no confusion. Blood from the left ventricle then gets pumped up through the aortic semilunar valve. Again, the flaps of this valve look like half moons. Into the ascending aorta, the aortic arch, and then the descending aorta, which drops back down behind the heart here. In a normal heartbeat, what you expect to happen is the two atria, the left and the right, will contract simultaneously, pushing blood simultaneously into the two ventricles, filling the two ventricles. Then you get the ventricles contracting, which squirts blood up into the two main arteries, the pulmonary trunk or the aorta, depending on which ventricle you're coming from. So it goes lub is the atria, dub, lub dub ventricles, atria ventricles, lub dub. Basically, it's two pumps in one. The right heart receives blood from the body, the systemic circuit, and puts it out to the lungs. The left heart gets blood from the lungs and pumps it out to the body. But they work in unison and they work simultaneously. So that's basically the heart anatomy and function. So here are the heart terms. Valvulo refers to valves. So valvulotomy would be an incision into a valve. An inflammation of a valve would be a valvulitis. Atria, of course, refers to the atria, either one of the atria. You'd have to specify left atrium or right atrium, but it refers to the atrium. You might have an atrial fibrillation, which is an uncoordinated contraction of the atria. Since they're supposed to be contracting simultaneously, sometimes they get an errant electrical signal through the atria and it never really contracts fully. It flutters. I'll put it that way. That's often how it's referred to as a flutter. So it's not actively pumping. It's not properly pumping. Septo refers to the walls between the atria or the ventricles, and you'd have to, again, specify. So if we look back at our heart here, it's hard to see the atrial septum, but there is a wall between the two atria. The left atrium actually wraps around behind the heart, and so you can't really see its septum very well, but you can see the ventricular septum very clearly here. Now, in a fetus, the fetus is not using its lungs, and so instead of pumping blood out to the lungs, you want it to go straight from the right atrium to the left atrium and back out to the body and the umbilical cord, where it's going to get its oxygen from the placenta. So there's a hole between the right atrium and the left atrium in fetuses. That hole should close up almost immediately after birth. As soon as the lungs begin to be used and you severed the umbilical cord, that hole closes up between the right and left atrium so that you get blood into the right ventricle and out to the lungs. Sometimes you can have an atrial septal defect where that hole doesn't close up and they'll have to perform open heart surgery on that infant. Septoplasty would be, of course, surgical fixing or repair of a septum, either the ventricular or the atrial. Ventriculo, of course, refers to the ventricles. A ventriculotomy would be an incision into the ventricle. We know that from the first chapter, cardio means heart. Cardiology is the study of the heart. Cardiac arrest means the heart has just stopped beating altogether. There's no more activity whatsoever. Myocarditis, we've got a couple roots here. So itis is an inflammation, not just of the heart, but of the heart muscle, the muscle of the heart. Corono refers to the blood vessels of the heart. Well, literally it means crown, functionally it means heart, and the coronary arteries are the arteries that feed the heart muscle itself. A coronary thrombosis would be a condition of a clot in a coronary artery, which will lead to a heart attack or myocardial infarction, one of the terms you'll have to learn later on in this chapter. The circulatory systems, I mentioned that there are two. There's the pulmonary circuit, which involves the right heart. So deoxygenated blood here is encoded by blue. Blood is given up oxygen to the tissues. It comes back deoxygenated to the right heart and is pumped out to the pulmonary circuit, where it gets oxygenated and it dumps its carbon dioxide in the lungs. And oxygen-rich blood comes back to the left heart and is pumped back out to the body. So two circulatory systems connected through the heart. All arteries carry blood away from the heart. That could be the pulmonary artery. Even though it's carrying deoxygenated blood, it's still an artery carrying blood away. All arteries bifurcate or split into smaller and smaller vesicles called arterioles. Remember, eole is a way of saying small artery. Arterioles bifurcate or split into smaller vessels called capillaries, and that's where the exchange actually happens. Capillaries will anastomose. Anastomose means that blood vessels are coming together to form larger blood vessels. Where two small blood vessels come together to make a larger vessel, that's called an anastomosis, a connection between two small vessels making a larger vessel. So you anastomose small vessels into venules, a term for small veins. Venules anastomose into larger vessels called veins that bring blood back to the heart. And that's the anatomy of the circulatory system. Words related to it, angio, vaso, and vesiculo, all mean vessel. So an angioplasty would be surgical repair of a vessel. Angiogram typically would be a picture. Literally, this means a written record, but functionally it means a picture of a vessel. A vasodilator is anything that causes that vessel to relax and open up. Vasculitis would be an inflammation of a vessel. The aorta refers to the largest systemic blood vessel, the aortic artery. That's the first artery out of the heart towards the body. If it becomes inflamed, you have an aortitis. It sometimes can form stones, so you'd have an aortolith. Arterio refers specifically to arteries that carry blood. So an arteriosclerosis is a condition of hardening of the arteries. In this context, sclero does not mean the whites of your eye. It means hardening. Endarterectomy would be a removal of the inside of an artery. In other words, the lining of an artery. Usually refers to removing some sort of plaque from the inside of an artery. And the kind of plaque would be an athero. Athero refers to a fat-filled plaque. So you can have atherosclerosis, which is a condition of a hardened fatty plaque on the lining of inside of the artery. It differs from arteriosclerosis. Arteriosclerosis is the hardening of the artery itself. This is a hard plaque in the artery. And of course, we had flebo and veno in the last video. Both mean vein. And I want to emphasize this because we'll come across this in another organ system. These three terms simply mean vessel. While oftentimes they do refer to blood vessels, They are context specific. Since they just mean vessel, they can mean other types of tubes that carry other kinds of liquids other than blood. If you want to specify that you're talking about a blood vessel, then you have to specify arterio as an artery or flebo or veno for a vein. Those are specifically carrying blood. But angio, vaso, and vasculo could be any kind of vessel. And that does it for the cardiovascular system.